The aim of this next module is to raise children's awareness of sounds around them and to develop really good listening skills. There are lots of fun ways you can incorporate listening skills into your program, and you're probably already doing some of these things. So you can adapt any of these activities for your program. A great place to start is by informing your parent group that you'll be focusing on listening skills for the coming weeks. As with the other modules, there is a letter to parents template for general sound awareness, and you can use this template in however you best communicate with your parent group. You can use it as a letter, you can pop it in their pockets or bags, you can use it on your Facebook or website. In the letter to parents, there is suggestions for activities as well as apps that they might like to use at home to help their children develop listening skills. So as part of this module on good listening, we're also going to be teaching the children about healthy ears and how to blow their nose to keep their ears healthy. Now you can use this PowerPoint and information in whatever way suits. You probably don't want to give a PowerPoint presentation to your children, but have a look at the PowerPoint with colleagues and you can work out how to present this material to the children. Really important. We need to teach the children why it's important that they blow their nose, and we need to teach them how to do it correctly. So we'll spend a little bit of time talking to the children about how their ears are connected to their nose through the back by a tube. It's called the eustachian tube, or you can call it the ear tube. And that when you get a cold or flu in your nose, the tube between your nose and your ears can get blocked and it can make your ears sick. Important to tell the children what to do if that happens. They need to tell their parents or carer, or they need to tell their teacher at school or in their early childhood setting that their ears are sore. You can talk to them about the importance of getting their ears checked by a nurse or a doctor and that it doesn't hurt, particularly when their ears are healthy. It's a good thing to check and that they shouldn't be frightened about that. So this diagram might be useful to show the children how their ears and nose are connected inside, and that when their nose gets blocked up with mucus, that can block up their ears as well, and they can get an infection and sickness in their ears. So how does this feel when I have a sick ear? You could spend a bit of time talking to the children about how that might feel. You might not be able to hear properly. It might be a little bit like when you're underwater in the swimming pool and you can't hear people. Your ear might be sore. There might be some discharge, mucus or wax coming out of your ear. You might feel unwell, have a temperature. You might feel grumpy or sad. And often as an educator, you might notice children's behaviour going off a little bit when they've got a middle ear infection. You can talk to the children that when you're sick, you might not be interested in eating food. You might have sore tummy, diarrhoea, vomiting. Or sometimes you can have a sick ear and not have a lot of symptoms. So what's the best way to blow your nose? Spend a bit of time with some tissues, a rubbish bin and hand sanitizer, and teach the children how to blow their nose correctly. You've already talked to them about the tube connecting their nose and their ear, so talk about the importance of unblocking your nose by blowing your nose rather than sniffing all that muck back up into their heads. So first you need a tissue. And tissues can be made of, tissues are soft and sometimes they're soaked in lotion, so that can be quite soothing. Or you might need a handkerchief. Some children will have a handkerchief. You can talk about those. The importance of washing them regularly so that you're not putting germs back on your face. And in an emergency, toilet paper or paper towels can be used, but they will irritate your skin over time. So show the children how to block off one nostril with their finger. Doesn't matter which side you start with. Press it closed and have your tissue or hanky ready, and then blow gently through your nostril. Take a deep breath and blow that air through your nose. And when you do this activity with the children, you'll see that some of them have a bit of difficulty. They might blow the air out their mouth. So good time to take some time and practice. Don't blow too hard. You don't need to force anything. Maybe something will come out, maybe not. That doesn't matter. And you can help them find a good spot by moving their finger around to block their nostril. And then switch sides and do the other side. So cover the other nostril and again blow gently and then stop. At the end, you need to wipe your nose with a clean tissue or a clean section of your handkerchief. Make sure there's nothing left on your face. Throw your tissue away, fold up your handkerchief and put it away in your pocket. And then wash your hands to get rid of all of those germs so that when you touch people or toys, you're not going to be spreading any germs. You can use warm water and soap and then a clean towel, or you can use hand sanitizer. And in these post-COVID days, I think we've all learnt a lot about hand washing. Some things you can talk to the children about to help unblock their nose. Drinking lots of water is really important. Having a hot, steamy shower or a bath can help clear your nose. And sometimes eating something spicy can also help clear your nose. So just to summarise the points you want to teach the children, to wash your hands after you blow your nose, to tell someone if you've got a sore ear, to stay healthy, we want to drink lots of water, eat healthy food, wash every day with a shower or a bath, and you've shown them how to blow their nose from one side at a time. So summarise, you can talk about 3 things to remember. They'll remember these things. You want to catch those germs in your tissue, you want to throw it away, and then you want to kill the germs by giving your hands a really good wash. Keep it simple, repeat it often and demonstrate to the children, and this is a great skill to be teaching the children, and you'll notice that everybody's ear health will improve. Thank you.